today. I am from Southwestern University of Finma. So today I will be demonstrating about the Leopold's maneuver. So before we start the procedure, we'll do a proper hand hygiene. After doing the hand hygiene, next is to identify our patient and provide privacy. So I already closed the doors and closed the windows for my patient's privacy. Next, I will be identifying my patient with two modifiers, which is the name of the patient and the birth date of the patient. So good day, ma'am. What is your name? And then your birth date, ma'am. Okay, so did you already pee, ma'am? Because in this procedure, we will encourage our patient to have an empty bladder. Alright, so you're done peeing. That means that my patient is ready for the procedure. Next thing is we need to explain what we are going to do to our patient. So, ma'am, I will be doing Leopold's maneuver. So basically, it is just a palpation and we will be determining the position of the fetus and the attitude of the fetus in your womb. So, okay. And we will also, in addition to that, ma'am, we will also find or locate the back of the fetus for us to have a clear fetal heart sound. Next is to place the client in the dorsal recumbent position, supine with knees flexed, and to relax abdominal muscles. I already placed a small pillow under the head of my patient so that my patient will be comfortable throughout the procedure. So always, before anything else, always remember that you need to use your palm for palpation and your hands should be warm through rubbing together like this. Before you palpate, you just warm your hands because cold hands can stimulate uterine contractions. So in measuring fundal height correctly, we need to use tape measure. In the first part of the Leopold's maneuver, which is the determining of the presentation of the fetus. So, to start with, stand at the side of the bed. So I am here at the side of the bed, facing the mother, and palpate the uterine fundus with warm hands. So you need to rub together, and then you need to locate the fundus. So right here. So we need to palpate. Okay? Palpate with your hands. So in this maneuver, you can touch either the head or the buttocks of the fetus. The head is in the fundus. You can feel a hard, round, and movable object. The buttocks is in the fundus. You can feel a soft and irregular shape. It is more difficult to move. That's it for the first maneuver. Now we will proceed to the second maneuver. So this helps us determine the fetal back. So we will place the palmar surface of both hands on the side of the abdomen, right here, and apply a gentle but deep pressure in one side of the abdomen, like this. Okay? Okay, so while doing this, we need to be reminded that the fetus back, which is smooth, hard surface, should be felt on one side of the abdomen. This is where we can best hear the fetal heart sound. That is why we are wearing our what we call this stethoscope. On the other side, you can feel the irregular numps and lumps, which may be the hands, the feet, or the elbows, and the knees are felt on the opposite of the abdomen. So okay, so that's it for the second maneuver. We will proceed to the third maneuver. This is how we know the engagement or if the baby is engaged or not. So the first is grasp. So I will lower this. So first is grasp the lower uterine segment like this with thumb and finger, and press lightly and make a gentle movements from side to side. Okay, so this is how we determine if we can lift the heads up. We can feel it that it is moving around, which means the baby is not engaged. Okay, so if we can feel or we can lift the head right here. If we can lift the head and then we can feel that it is moving, it means that the baby is not yet engaged. While if we can't lift the head of the baby, it simply means that the baby is engaged. So that is it for the third maneuver. We will proceed to the last maneuver, which helps us determine the attitude and the cephalic prominence. First is the stand on the other side, right here. So on the opposite side. So I will face the feet of my patient. So first is stand side facing the mother's feet. Then place the tips of the 3 fingers on both sides about 2 inches from the inguinal ligament and apply pressure downward like this. So like this. Downward and in the direction to the birth canal. Okay. Okay, so that's the end of the Leopold's maneuver. So after the procedure, after everything, so you need to cover up the client, and make sure that our client is in comfortable position.